Speaking of that, Paul Krugman's column the other day, once again, it just, what he wrote about blew me away. I guess everybody's familiar with those pop up medical clinics. We've had them in downtown Atlanta for the underserved population of Atlanta. Now, by that I mean the non white population of Atlanta. We've had several of those. Usually they pop up in rural areas where people cannot get medical care. Women can't get medical care because every Planned Parenthood office has been closed down because of bomb threats or assassination attempts. And the governors of so many Republican states have refused Medicaid expansion, so people are left with no way to take care of their health needs. Think about that. Fucking think about it. I mean, that. Well, this past weekend, the Washington Post published a moving description of a pop up medical clinic in Cleveland, Tennessee. Now, it was, as these places always are, it was a temporary installation, put up very quickly, that provided free care for 2 days on a first come, first served basis. Hundreds of people showed up hours before the clinic opened. They treated thousands, but hundreds of people showed up early in the morning, stood in line, because rural America is suffering from a severe crisis of health care availability, with hospitals closing and doctors leaving because they can't make a living. And we live in a society where medical care is profit oriented. If they can't make money on people's sicknesses, on people's operations, on people's crises, on people's emergency care, if no money can be made from that, then they leave. Medicaid expansion would have provided the money basis so that doctors and nurses and medical technicians in hospitals could make enough of a profit to warrant staying in business. And it is a business. Krugman writes this, since the focus of the report in the Washington Post was on personal experience, what individual people had to go through, and how this particular pop-up clinic was literally, in some instances, a lifesaver. The Washington Post report was focused on that, not on policy. It's understandable, Krugman writes, that the article mentioned only in passing the fact that Tennessee is one of the 14 states that still refuses to expand Medicaid under the Affordable Care Act. So Krugman writes, I'm not sure how many readers grasped the reality that America's real health care crisis is largely, not entirely, but largely a direct result of political decisions. Of course. If you want to get just a brief sense of the politicalness of providing health care for Americans, think of what the Affordable Care Act, or AKA Obamacare, has gone through in terms of challenges in the courts, in the Supreme Court, in legislatures, in the U.S. House and Senate. Think of the assault that has been put on Obamacare when Obamacare was trying to do nothing but provide health care. They weren't trying to overthrow the world. Obamacare wasn't. It wasn't designed to destroy capitalism. Obamacare wasn't. It wasn't designed to make people sick, you dumb fuckers. It was designed to get people well. But look at what it's gone through. And by you dumb fuckers, I mean the states, the legislatures, and the governors who refuse it. All of them, by the way, led by Christians. Every single one of the states and the legislatures that have refused Medicaid expansion are run by Bible-believing, church-going, blood of the Lamb Christians. Krugman writes, the simple fact is that the Republicans who run Tennessee and other so-called non-expansion states have chosen to inflict misery on many of their constituents, rural residents in particular. And it's not even about money. The federal government would have paid for Medicaid expansion. Of course, remember the first 3 years would cost the state nothing. And from that point on, the federal government paid 90%. Oh, no. No. We'll have none of that. We're Christians. Krugman writes, so if rural America is suffering, a large part of the explanation is gratuitous political cruelty. This cruelty has denied health insurance to millions who could have had it with a stroke of the pen by these governors. And rural hospitals are closing and doctors are leaving for what I said, because people can't afford anything to pay for medical care. So what are doctors and nurses and medical technicians supposed to do? Krugman writes, to see what I mean, just compare Tennessee with its neighbor, Kentucky. As recently as 2013, just before the Affordable Care Act went into full effect, the two states looked very similar in terms of health care. In both states, about 20% of non-elderly adults had zero health insurance. But unlike Tennessee, Kentucky eventually did expand Medicaid and also did its best to make Obamacare work. It did. The result was a 2/3 drop in the uninsured rate. At the same time, progress in Tennessee was very limited. That was in Kentucky. At this point, adults in Kentucky are twice as likely as their neighbors in Tennessee. Adults in Tennessee are twice as likely as their neighbors in Kentucky to lack health insurance. According to a Georgetown University study that's covered a 7-year period spanning the introduction of Obamacare, the percentage of low-income rural adults without health insurance fell 27 points in Kentucky. In Tennessee, 6 points. And Krugman points out what he's pointed out many times and what people have tried to point out to folks who continue to vote Republican for some fucking insane reason. Krugman points this out. If the United States were like every other wealthy nation and provided some kind of universal health care, there would be no uninsured at all. Those heartrending scenes in Cleveland, Tennessee, and if you want to read the article, go to WashingtonPost.com and you can find it. Those heartrending scenes in Cleveland, Tennessee would be inconceivable anywhere else in the so-called advanced world. But the Affordable Care Act isn't some future aspiration, something to aspire to. It's an already existing program. It's available. And a lot of rural America's medical misery could be mitigated, if not avoided entirely, if states like Tennessee were willing to take advantage of the program that's there just waiting for Tennessee to say, we'll take it. But the Christians who run Tennessee won't do it. I'm sure they have their reasons. Krugman points out we're not just talking about having insurance, we're talking about whether there are doctors and hospitals available to provide care. Rural hospitals have been closing in many states, but a project that tracks rural hospital closings for the past 10 years finds that a great many have taken place in states that didn't expand Medicaid. And it's there waiting for the people Now, forget the government, the state government. It's there waiting for the people. Medical care, health coverage. And the governors and the Christian Republican legislatures say, no, you're not going to have it. Hi, Truth Seekers. Mike Malloy here. As you know, we've switched formats and are now broadcast exclusively on the Progressive Voices Network. So that means you get fewer program interruptions, no corporate commercials, and lots of profanity. But our format change also means some of our radio listeners no longer hear the program. It's been a while since I mentioned our podcasts, so you may have forgotten that there is a way to listen to this program anytime you need a good dose of screaming. Visit MikeMalloy.com and subscribe to our podcasts. You have your choice. You can listen to the ranting with the audio podcast or listen and watch me lose control with a video podcast subscription. As a podcast subscriber, you can download the program to your mobile device and take me with you wherever you go. And if you have a friend who needs a dose of truth-seeking, you can give a gift subscription as well. That's MikeMalloy.com, and never miss a minute of the uncensored fun and frivolity.